Got up, I went to work as usual. I just went in the house and I lay down on the sofa. And I said, oh, I feel so weird. I have a headache, I just don't feel good in general. And I felt a tingling in my arm. So when I went to the hospital, got to the hospital, I said, well, I'm having some chest pain. I had some chest pain. The doctor, he said, okay, we're gonna do a, I can't remember, MRI or CAT scan. And he explained to me that they saw 2 aneurysms.
Generally, individuals with aneurysms present with headaches, some focal neurological symptoms, such as blurred vision, weakness in the arm, leg, or tingling, and sometimes even neck stiffness or neck pain. Ms. DeVoe, in our situation, when she presented to Memorial West, was found to have 2 large intracranial aneurysms, and her presenting symptoms were some dull headaches that had been persistent. Given her risk factors of high blood pressure and history of smoking, and the other risk factors are family history as well as being a woman, we determined that it would, first we would treat both of these aneurysms in her brain and then proceed with the interventions necessary for the heart. First, we treated the brain aneurysms in a staged fashion. We used a very innovative device called a pipeline flow diversion device to treat the giant carotid artery aneurysm on the left side of the brain. This flow diversion device is basically like a stent that's made up of cobalt and chromium that can be deployed within the parent artery itself, in her case the carotid artery, and allows reconstruction of the artery without any manipulation of the aneurysm itself. And over time it disrupts flow inside the aneurysm, the blood flow, and allows the aneurysm to essentially clot off and then over time be reabsorbed by the blood vessel. The following treatment was for the right brain aneurysm in the middle cerebral artery. And this was also a fairly complex lesion in the sense that it was arising at the sort of junction of 2 main arteries in the brain that supply a lot of blood to the right hemisphere. It required not only coils inside the aneurysm, but to permit coils to safely stay in the aneurysm and not prolapse into the parent artery and cause a stroke, we also had to use a stent to remodel the middle cerebral artery such that the aneurysm was able to be packed well with coils while maintaining the patency of the parent artery. Sometimes patients, depending on where these aneurysms are located, may have some mass effect as the aneurysm clots off due to lack of blood flow, some pressure on the adjacent nerve fibers. So in her case, she had a little bit of a cranial nerve palsy where her eye movement in the left side was affected temporarily. The main prevention guidelines we give patients after aneurysms have been discovered to minimize their risk of rupture if they present and they're unruptured at that time, or if they have family history of aneurysms, is smoking cessation if they continue to smoke, blood pressure control, as well as diet and exercise. I think optimizing all of these potential risk factors lead to decreased likelihood that an aneurysm would rupture. At Memorial, we're proud to have a comprehensive stroke center both at Memorial Regional Hospital and Memorial West Hospital, where we have 24/7 neurosurgical capabilities for patients with brain aneurysms to evaluate them in a timely fashion and provide the necessary treatments. At Memorial, we're at the cutting edge of using these treatments and devices to achieve the best possible outcomes for the patients.